Hi everybody, Dr. Grant Stevens here from the Technology of Beauty. I'm here in beautiful Park City, Utah, home of ABAM, the American Brazilian Aesthetic Medicine Meeting. And we're here in Park City at the meeting, as you can see, and we're gonna go interview various vendors and doctors here at the show. This show happens every year. This is the 15th anniversary of ABAM. It's a fantastic opportunity to learn from experts from all around the world. We literally have experts from all around the world here at the American Brazilian meeting, and we have the very best in the aesthetic industry. So come on, let's go see who's here this year. Hi everyone, Dr. Grant Stevens here in Park City at the American Brazilian Aesthetic Medicine meeting. And we're filming here the Technology of Beauty. I want to share with you our next meeting where we're going to be filming. And that's April 19th in Miami at the Aesthetic Innovation Summit. This will be our fourth meeting of AIS, and we're going to have a terrific time. The schedule is packed with experts from around the country and actually even around the world. So I encourage all of you to go ahead and register for AIS 2023 in Miami, Florida. See you there. Hello, everyone. I'm Dr. Grant Stevens, and I'm back here at the Technology of Beauty, where we're filming here in Park City, Utah at ABAM, the American Brazilian Aesthetic Medicine meeting. And today, I have the opportunity to interview Dr. Foad Nahai. Hello, Dr. Nahai. So great to have you.
Thank you.
Now, this is Dr. Nahai's, I think, third time on the Technology of Beauty. Once in the studio, once last year at ABAM, and then now. And it's such a rare opportunity to be able to talk to him. And he's not just a plastic surgeon, he's my dear friend. And I first met him when I was a medical student in the 70s, if you can believe it, at Washington University in St. Louis, when he was a young plastic surgeon just out of residency with he and Steve Mathis, a little known fact that will come out actually later. In any event, Dr. Nahai is a professor of surgery at Emory University in Atlanta. He's also presently the editor-in-chief of the Aesthetic Surgery Journal. He has held numerous titles and so forth. He's one of only two people to be the president of the American Society and the International Society of Aesthetic Plastic Surgeon, the only other person being Renato Salt, who's the host of this meeting. In any event, today we have Dr. Nahai, and I have the chance to ask him about the present and the future and what he sees for aesthetic plastic surgery and aesthetic medicine. Thank you for joining us. Dr. Nahai, so wonderful to have you.
It's good to be here, good to be back in Park City. The sun is shining, the slopes look great, and you and I are sitting here chatting. This is an exciting time for aesthetics in general, for aesthetic surgery, and particularly for those of us who have an interest in facial rejuvenation, which isn't just facelift, it does include cosmetic medicine. The reason I say it's exciting is because facelift has made a comeback. Over the past 10-15 years, with a meteoric rise of the injectables, people either felt they didn't need a facelift, that injectables were a substitute, or wanted to postpone the facelift. And the injectables are affordable, effective, and at least in the short run, very cost-effective. So it's exciting for me to see that surgery has come back, because I had always maintained, as good as the non-invasives are, in some patients, the results can match what you and I can do surgically, but in others, it left a lot to be desired. And one of the areas where I felt it was my responsibility was to tell a patient, yes, I'm happy to inject you, I'm happy to recommend non-invasives, but in the long run, the result of the facelift would be better, it'll last longer, and over the 8 to 10 years that the facelift will last, it'd be more cost-effective. But there were issues. It was the question of the economy, or the question of, do I have the time? Do I have the time to recover? So it's exciting to see that facelift is back, because a lot of those patients were settling for what I felt was second best. Now, there was a group, and still is a group, who come in, and I have no doubt that the non-invasives are best for them at their age, at the stage of the aging of their face. So that's one of the exciting things for me as a surgeon, to see that facelift is back. For me, as someone who's interested in the entire package, it's very good to see that we now have refinements and improvements in the fillers. When I try to talk to our fellow, I have to pull out a list and show him how many variety of HA fillers we have, and try to explain where each is best suited for, what the differences are, and where they perform best. Daxi is out. It's very exciting to be able to offer our patients something that's going to last longer than the neuromodulators that we were used to. So this is another exciting development. I've always had some concerns about what I call the skin tightening technology. In the early days, in the pioneering days, the results were not consistent, and definitely, maybe even today, the results don't match surgery. But it was a good technology to have, and have it available for those patients who either were not candidates for surgery, or their state of health was such that a 4, 5, or even a 6-hour facelift was contraindicated. So I just call them the collagen-inducing technologies are emerging. We just don't have one type of technology. Now we're having several new and more exciting, and I'd like to think, or at least I hope, more effective technology for those patients who opt for it. So it's a very exciting time. What do I see for the future? Even with the downturn in facelifts, I used to teach my fellows, don't hang up your knife yet. You will need to know how to do a good facelift, but equally learn how to be a good injector, learn everything you can about the non-invasives, and know exactly which patient, which modality works for best. So I think we'll see more of that. I also feel that we're going to see a younger group of individuals coming forward for surgery. So do you do a deep plane facelift on everyone who comes into your office? I know some do, and I have gone around lecturing nationally and internationally on what I call a bespoke or a custom facelift. So we don't do the same facelift on everyone, because not everyone ages the same. Not everyone has the same volume loss. It's like walking into a fashion store and you want a custom-made suit. They take your measurements. You don't just get something off the rack, a one-size-fits-all. So I think we're now getting to that stage where most of our trainees and a lot of the younger plastic surgeons realize that there is no one-size-fits-all for facelifts. You have to customize the incision you make, how far you undermine, what you do with the SMAS, and probably now, most important of all, the ancillary procedures, the resurfacing, the lip lift, the earlobe reductions. And as I'm sure you know, lip lift has become very much in vogue, and I'm happy to see that there's several different ways of doing it. And in the right patient and in the right hands, each is the right procedure to undertake. I'll mention buccal fat pads. I've been working on the buccal fat pad for over 35 years, yet there's a boom. I won't say it's a fad, because I happen to believe that it's effective in reshaping and recontouring the face, but So I think lip lift, I think buccal fat pad excision will continue to remain popular. So in terms of the future, more refinement of our fillers, as we've seen with Daxi, a longer lasting neuromodulator. We're going to see different fillers. We're going to see them last a lot longer. We've already mentioned the collagen-inducing technologies. Resurfacing technologies are emerging. Dare I say we're going to see some do-it-yourself technologies come into my office. Exactly.
Okay.
Come pick up this and go home and treat yourself. You will rejuvenate your own face. So those are what I see. But long term, I see a bright future for us as plastic surgeons, bright future for us as aesthetic surgeons doing facial rejuvenation. Facelift will always be there. Other areas of the body, breast surgery, the emergence of the scaffolds and the options to support a breast when you lift it, those are going to continue to grow. And as we've already seen at this meeting, the refinements not only in the equipment that's available to us, but the techniques that are available for body contouring. I've always said, liposuction, the myths of liposuction, several. One of them is that it's easy. I'd say, yes, it's easy to push a cannula in and out, but it's very difficult to reshape and recontour a body. So a lot of exciting things going on in the aesthetic field.
Yes, indeed. Now let's go back to the face. And would you comment on the periocular and brow area, which is to say around the eyes and the forehead?
Oh, around the eyes and forehead, I have seen so much evolvement from the days when the only option we had was an incision from the top of one ear to the other to reshape and reposition the brow. Then came along the endoscopic method where you made 3 or 4 tiny incisions instead of a cut all the way across. But the problem with that was you needed a lot of equipment. There was a learning curve. And then along came the neuromodulators. Along came botulinum toxin. And to this day, and this is a surgeon saying this, the most effective way to reposition and elevate the brow and reshape it is still with the injectable botulinum toxin. Now, there are some other less invasive methods of elevating the lateral brow. We call it a temporal brow lift, modifying the frown muscles through the upper eyelid. The area that we have seen most change is on the lower eyelid. The lower eyelid, we had several options, but the best was to cut the skin, cut the muscle under the lower lid, and then work deep to it. Then came along a procedure where instead of making a skin incision, the incision was made inside the eyelid to remove the fat or to redrape the fat. And then the biggest disruptor of all, and probably one of the most significant advances in facial rejuvenation, was fat grafting. So I'm not doing as many of the cut under the eyelid, cut through the muscle and skin. We're doing it through the inside of the lid. We're adding fat instead of removing it. So that's totally changed.
And wouldn't you say the same is true with the upper lid? Are you removing less fat now from the upper lid than you did 20 years ago?
Exactly. In fact, we used to say, upper lid lift isn't just taking the skin, it's working deep to the skin, working on the fat, whereas frankly right now, most of the time, all I do is just remove the excess skin that's hanging down. Very rarely remove a little of the fat near the nose.
So you mentioned the body, and I'm particularly interested in, as we've coined it now, beauty below the belt, in particular cellulite and skin laxity and contouring. you mentioned, and I agree with you, liposuction looks easy, but to do great job of liposuction requires artistry and the ability to see the body you want to create, especially when you add fat transfer to fat removal. So what are your thoughts about this emphasis on beauty below the belt or aesthetics from the waist down?
It's certainly something that's become very, very topical. We're all interested in it. And the reason something all of a sudden gains in popularity is because the results have improved. As we talked earlier with liposuction, it was just what we called spot removal. Mm-hmm. I don't like my muffin top. It was removed. Now, the procedures are so refined, and I'll add the word patience to what you just said. It takes time and patience to recontour below the belt, and it's become popular because the results are worth it. Patients can see a difference rather than, oh yeah, just that little area of excess fat was removed.
Right. I apologize. The group is practicing for tonight's cowboy night here at the ABAM, American Brazilian party is tonight, and it's the cowboy night. So we have the group practicing right next door. So you get to listen to the group at the same time as listening to Dr. Nahai.
Well, it's good. It's good to have some background.
A little background music. Keep this technology of beauty lively. We've not had this before. So I agree with you. The technology are much better, much more reproducible. I know we have a new cellulite technology that has long-term follow-up that's been published recently in your journal, in our journal. And we're very excited about that and other approaches to skin laxity and body contouring. So I know how close you are to the Aesthetic Society as well as the International Society. We have a big international meeting coming up, I know, this summer in Athens. Will you be going to that?
I was planning to, but plans have changed. If plans change again, yes. We were there in Istanbul last September for a world-class event, world-class scientific presentations, and Athens will probably be the same. And who knows, maybe things will change and I'll be there.
Okay. And I know you're going to be in Miami this April for the Aesthetic Society meeting.
Oh, absolutely.
You wouldn't miss that. Neither would I.
No, we never miss that. We're looking forward to it. Miami's a great place to go to. April is going to be a great time.
Right. That's April 19th to the 23rd. And you can register at the Aesthetic Society or surgery.org to go and join Dr. Nahai and myself. And before it starts, we have the Aesthetic Innovation Summit, or AIS, which is always a fun day, and then Hot Topics, which is always so exciting.
Yes. You mentioned your paper on basically subcision for cellulite. I'm going to backtrack. I'm in the 5th decade of my practice. I've completed 4 decades.
Okay.
And I've had to tell patients that I don't know of anything that consistently works on cellulite. Now we have something that consistently works. And your paper has long-term results. And by the way, the print, April print contains your paper in it. And that's the one that we call the annual meeting edition of ASJ.
I'm so excited. I thank you so much. Myself and the other 7 investigators, so there are 8 of us, who use this controlled subcision, which is a unique proprietary device and that allows us to identify and verify, and that's the key. We identify and verify release. And myself and my 7 authors, we have a 1-year follow-up, and the patient satisfaction is higher than I've ever seen. I don't have quite as long as you do, but I have 34 years of experience in telling patients very similar things. We don't have a great approach, and now I don't say that. And now I say we do have a wonderful, easy, reproducible way to relieve you of the dimple cellulite. Now, one of the challenges is separating out dimpled cellulite from skin laxity. Oftentimes, as you know, some patients will think that they have cellulite, and they may have some, but actually they have skin laxity. And that therein lies a whole other topic, right?
Absolutely.
And then within cellulite, you say cellulite, I say cellulite. We can't even agree what to call it. And thus, I don't believe we can agree what it is, because some people have wavy, and they call that cellulite. Other people have ice picks, and they call it cellulite or cellulite. This technology is great for ice picks and dimples, not for wavy. Wavy is closer to skin laxity and so forth, as you well know. But
absolutely,
that's important. Patient expectations and your expectations, if you're a patient who wants to have a smoother bottom or thighs, we don't want you to be disappointed. And that's key. And that's key for the doctors, key for the patients, don't you think?
Exactly. The patients that are happiest are the ones who know what to expect, who can be given a reasonable idea of their final result and are aware of the things that can go wrong, but fortunately those are rare.
Right.
The patients that are disappointed are those with unrealistic expectations, and those who sadly may be misled by their provider that this technique or this procedure is a panacea. It's going to take all care of all your concerns. You'll have a perfectly shaped body, tight skin.
Yep, that's it. Managing expectations.
Exactly.
Being honest and real with the patient. Well, listen, we could talk for hours. It's time for you to go do your dancing in the other room,
exactly.
I think. I'm pretty sure.
I have to rehearse for tonight.
Yes, you are. And, I want to see you on that mechanical bull.
Absolutely.
With your cowboy hat and everything. And I hope you bring my girlfriend, his wife, down to the party also.
She won't miss it.
Great. Thank you very much.
But we'll miss yours.
Dr. Nahai, yes, we will, unfortunately.
Thank you.
Hello, everyone. I'm Dr. Grant Stevens, and I'm here in beautiful Salt Lake City, Utah, home of ABAM, the American Brazilian Aesthetic Medicine Meeting. And with us tonight is Herluf Lund. He who is a plastic surgeon, the past president of the Aesthetic Society, a friend of mine for many years. In fact, when I was a resident, he was a medical student. Is that true?
Yes, I was your medical student, and my job was to basically keep you out of trouble, and you kept me out of trouble, and I think we both did it okay.
All right. Well, Herluf has graciously offered to come and talk to us. We're here, as I mentioned, at ABAM. We're getting ready to go to the Western night tonight, and we're going to be riding the mechanical bulls. But before we do that, let's learn a little bit about Herluf.
Now, it's good you catch me before the bull, because otherwise it would be post-concussion syndrome.
No, I've seen you ride that bull before.
Oh, no, I get bull, but I don't ride it. So
you're from St. Louis?
St. Louis, born and raised there.
You come from a long line of physicians?
I do. My whole family is basically all doctors, and many of them are surgeons, a number of urologists along the way, but one of the greatest influences was my uncle, who is a general surgeon, did a lot of breast cancer surgery, and that led to me being interested in breast cancer reconstruction. And that led eventually into the world of plastic surgery, where I eventually met this guy.
150 years ago.
Well, that's not exactly.
Okay. Then you finished your residency in plastics at Washington University, right?
With the same boss that you had, Dr. Weeks.
Dr. Weeks and Dr. Leroy Young.
Okay, my hero.
Yes, indeed. And then you joined the practice there in St. Louis, right?
I started out solo at first, and for the first 10 years, it was by myself, and then I kept finding myself moving more and more into the world of aesthetics, and as I moved into aesthetics, I was approached by the largest aesthetic group in St. Louis, led by Bruce White at the time, and it just happened to be a right synergy, right place, right time, and then I made the jump, and it's been 20-some-odd years, and I'm still there.
Yes, and you're a leader of that group now.
Well, I think if you hang out there long enough, they eventually make you the president of this thing. So, yeah.
And that's where you are now, right?
Yeah, president of St. Louis Cosmetic Surgery.
Yes. So tell me, how's it going? What are you primarily doing nowadays?
Well, it's actually, business is booming. St. Louis is, despite people thinking that sometimes nothing happens in St. Louis, actually we have a very active plastic surgical community. As you know, it has history, it's quite strong. Our practice is doing quite well. We brought in a new young partner, Dr. Sahadi, and she's amazing, and everyone should check out her. She's just booming with great ideas and great skills. I like to say my practice is still going very actively, and so far I have no complaints. I have found some things along the way that, I was just talking to a good friend of ours today, Monty Eves, and I have to credit, even old dogs can learn new tricks. And Monty has invented a device that I was literally telling him, I don't think I could envision doing surgery these days without his toy. So
that's great. And why don't you tell the audience what the name of that toy is?
It's called Bridget. And in full disclosure, I do have an investment in it, but it's minimal. But it's a little device that you put on the wound, and it basically adjusts the tension and takes the tension off the edge of the wound and moves the tension backwards. Therefore, the blood supply is very robust at the edge of the wound, and therefore the wound has much better chance of healing in an optimal way and less chance of breakdown infection. It's not just for surgery, but I can sit there and I've already seen it being adapted in ERs now. The places have it. The little kid gets to the cut, instead of having to come in, be anesthetized and all that, they just basically walk in, go clean it up a little bit, squeeze it slightly together, put 3 of those things on, see you, bye.
Fantastic.
Yeah.
Well, you're the past president of the Aesthetic Society.
Yeah.
And I know you're a trustee, the board of trustees. And we just interviewed Sue Dykema yesterday. And we're going to be losing Sue, I know, as our executive director. And we're looking for a replacement. I know you're on that committee looking, and as a trustee, you're very interested. Do you have any comments about the Aesthetic Society or Sue's replacement?
Well, first of all, losing Sue is a absolute heartache. And one of the things before I became president of the society is I made sure I negotiated an extension of 2 years on her contract, which just happened to get her past my presidency. Yes. And that the society is in an interesting position right now. And it is a loss when you lose a great leader like Sue, but it's a huge opportunity for us. And there's opportunity for us to bring in either outside or even recruit from inside to find and to look at the things that we've done in the past may no longer fit. It may no longer work. And we live in a changing world. Look what we're doing right now. Can you imagine doing this 20 years ago when you and I used to attend the meeting? We'd have films sitting out there, and we were carrying carousels of slide decks around. So this is a huge opportunity, and the leaders of the Aesthetic Society is going to be directing that society through these changes in the future. So it's critical that the Board of Trustees, such as yourself and the current leadership, choose well. This is a time to really, I almost hate to say, you have to move almost all your emotion out of it and step out and analyze it from a different view because we know almost all the people who are trying to be in this position. We have to find the right person.
I agree. Absolutely. It's imperative for our beloved society.
The Aesthetic Society to me is, I'm going to borrow from a past president, Dr. Jim Stuzen. He called it his family. This is my family.
Yes.
And I know it's yours too, which is why we get to be brothers without
different mothers. We interviewed Renato, we interviewed Foad, yourself, a number of past presidents have been on this program, and I want to thank you for appearing on the Technology of Beauty. Once again, it's great to have everybody. Now, let's go to the cowboy party. Hi, everybody. Dr. Grant Stevens here at the Technology of Beauty in beautiful Park City, Utah, home of ABAM, the American Brazilian Aesthetic Medicine Meeting. And I was able to get for us to interview Lou Scafuri, who's from Sofwave. And Lou, it's great to see you back here. Thank you for spending some time with us before you hit the slopes. Lou's here at the ABAM meeting, and he's also just came off of stage where we had a presentation of Sofwave right here, a beautiful technology that he's going to tell you about, a non-surgical technology. Lou, tell us a little bit about Sofwave.
So Sofwave is a company that provides non-invasive devices for the purpose of skin lifting, the treatment of fine lines and wrinkles, and most recently, it's been FDA cleared for reduction of cellulite.
Mm-hmm. And Jennifer Walden, the president of the Aesthetic Society, just gave a beautiful presentation here at ABAM, and it was well attended. How are patients doing, and what are you hearing from the doctors?
I would say, the most important thing is having a doctor like Dr. Walden be able to go up there, talk about the technology, share her experiences for both her patients as well as her practice, as well as the fact that she's a fan of having the treatments done. That's somebody in the know, somebody that has access to any technology, any other physician in the world who strongly believes that this technology has improved her practice and has exceptional amount of patient satisfaction. What's interesting about our technology, it was initially cleared for one and done, one treatment per year. And what we're finding is, and every practice uses it a bit differently, we're finding that the patients like it so much, just seeing results, whether it just be for a neck treatment, to get rid of the necklace lines, that they're coming back and requesting a full face treatment as well as the neck. So we think we're in the early days in terms of really understanding how far this technology will advance. Coming here to ABAM, yesterday we had an advisory meeting with top plastic surgeons from all over the world. And we have many, many ideas of other indications and other applications of the devices that hopefully we'll be able to provide as an adjunct to the existing device in the near future.
So can this be combined with other existing technologies?
Absolutely.
And what might come to mind? What might a practitioner or a patient have combined with this? Well,
I think today we have people combining it with fillers. In some cases, they're using things like a hyperdilute sculpture or something like that, and they're doing it both in the same day. First, they're treating the patient with Sofwave, and then they're going ahead and combining it with a filler. They're also combining it in some cases with color correction devices, where if someone wants that immediate pop, where they want to see something, because it does take anywhere from 2 weeks to see some initial results, with optimal results seeing 12 weeks out to see the benefits of the technology. And you know better than anyone that patients want to see results now.
Absolutely.
So yes, it can be safely combined with fillers, toxins, other energy applications, as well as exosomes or anything else that physicians feel are appropriate.
That's fantastic. Well, we're excited to see just where you're going to take this company. Thank you very much for sharing your time with us today, Lou, and good luck.
All right. Thank you so much, Grant.
You're welcome.
Very much.
Take care.
Thank you.
Hi there, Dr. Grant Stevens here in beautiful Park City, Utah, home of ABAM, the American Brazilian Aesthetic Medicine Meeting. And with me today on this special episode of The Technology of Beauty is Brad Calobrace, my dear friend and world-class plastic surgeon. Brad, welcome to the program. Thank you so much.
Thank you, Grant. I see myself in sweaters, so you know I'm somewhere cold.
Yes.
So we're in Park City.
Yes.
Glad to be here. It's my first time to be at the American Brazilian meeting, so I'm really happy to. And I'll be talking about, one of the popular subjects, fat grafting, and that's become so popular in plastic surgery. And so I get the opportunity to sort of share some of my experiences.
That's wonderful.
Yep.
I'm going to point out this is our 15th year of ABAM. And this is it's our 15-year anniversary. I hope you have so much fun. You'll come for the next 15 years also. We have international representatives. You're going to see so many of your international friends.
That's what I've done. So when I got here, all of a sudden it's like, just knowing everybody from all of our other meetings we go to and stuff. So I was like, I didn't know you guys came to this. So this meeting, you can tell, is an international meeting.
Yes.
And that's what's great. And Ronaldo does a great job of leading this meeting and stuff. So I was really happy to come and be here and be part of it.
And I am so happy that you're spending this time because you're about to go on stage. You're going to do a costume change, jump on stage. You're going to talk about Sientra's new fat grafting device.
Yes.
You want to tell us a little bit about it now?
Well,
what's behind the curtain?
Yeah, a little behind the curtain. I think this is the deal. Fat grafting has become super popular, and different areas of the body, we kind of process the fat differently. But maybe the most important place for me, especially, is in the breast. Not because I do a lot of breast, but because in that area we have to worry about breast cancer, surveillance, etc. So you want really, really good fat. You want to know what you put in there that's going to stay, and you're not going to have problems like oil, cysts, and nodules. So I was really negative about this system when I first saw it because it was an open technique. There's so many techniques out there with other devices. But then when I started using it, especially with the power of P188, their sort of aura cleanse, the Viality system really delivers something unique. So we did a multi-site clinical trial to actually look at this particular fat grafting and see if it is what we say. It's low complications, but high retention of fat. And actually in our 6-month data, which is still early, I will report an 85 to 90% retention of the fat, which is really high. Because I think if we say anything above 70% is really great.
Yes.
We used to say 50% was what we expected.
50, 60.
50, 60. So it's really, really good. So I'm just really glad to share it. And I think, like all devices, they've modernized the device. They've changed it a little bit to make it more user-friendly. And I think that's really good too. So,
is this a capital expenditure? Is it a reusable? Is it one-time use? What does this look like to the surgeon? Say,
yeah. So it's a one-time use device. I don't know how much it is, but I'm gonna be assured it's gonna be about the same as the other cost of the other devices. What I think is unique about it, not only the retention and the low complication rates, but is that you can do multiple volumes. It can go all the way up to 1,050 cc's. Because one of the limitations of one of the products I used before would be about 250 to 300 cc's, about all I could get out of the device, which sometimes wasn't quite enough. So to run the device a second time.
Sure.
So having a system that could handle enough, or possibly even use it in gluteal or buttocks augmentation with that too, because it has enough volume, would also be helpful. So I think it just gives some utility to have more volume.
Okay. And what's the name of it?
Viality.
Viality.
Like
okay.
vitality, but it's Viality.
And it's by Sientra, right?
By Sientra.
Okay.
Yeah, this came out of Harvard. So this is out of Jay's, work in Harvard, and Dan Delvecchio's, the concept of P188. It's a cleanser of the fat. But not only does it take out the blood and cleanse it, it actually increases the lubricity of it. So it becomes very slick. So when you're injecting the fat, it smoothly goes into the area, so you can lay down very smooth layers of fat, so you know exactly what you're doing. And I think that's probably the magic of the product.
That sounds terrific.
So I really love it.
Okay, moving on.
Yes.
So thank you very much for that.
Sure.
Tell us a little bit about your practice.
Yeah. So, and you know a lot about my practice. So,
but I want
the audience.
I want to guess.
So, I think that my practice, I would love to tell you that it was all planned, and my vision was realized. And I've always said in lectures that you got to know the end to know what the beginning should be of where you're going. I knew I wanted to grow something more special, but I'm in Louisville, Kentucky, and so I do say all the time, if I can do it in Louisville, Kentucky, you can do it anywhere. So I'm in my 26th year of practice. We have 3 locations. I have 85 employees. We have a large organization. It's 65% of my business is Medi-Spa business. So that's sort of, building that, what many patients are willing to do, which is non-surgicals. It's extremely important. It is important that I do great surgery, but that's only for a select patient population. We have to deliver great results for everybody, and for people who aren't comfortable or who are not good candidates for surgery. So, as you well know, because you have a huge Medi-Spa, maybe if I fashioned my Medi-Spa out of anyone, it's Marina Plastic Surgery, and what you were able to do with bringing in devices and technology, being cutting edge, being an early adopter, and really embracing technology because you believed in good technology that could deliver something important for our patients.
And the icing on the cake for our surgery patients. And to your point,
it is.
Some people are candidates for surgery either because of the time off work or their underlying health concerns or any number of things, cost and so forth.
And then when they do have surgery, maintenance of what we're doing. We don't just do the surgery, but we do the surgery and bring them in a program for lifelong care for them, for our patients. So,
and you believe in patients for life.
Patients for life.
Absolutely. I know you do.
I know.
You take great care of your patients, and they come from all over the world.
Yeah, so it's a very big practice. It's called Calospa, and in my practice it's called Calo Aesthetics. And so, we just try to take care of good care of patients and be leaders in the field, and then go back and share everything I do, like we share with our colleagues. I don't do trademarking and registering. I just share it, write about it, publish it, and try to, because I think when I do that, patient care is improved. I can only treat so many people. You can only do surgery on so many people, right? But the more of the young people I can educate, you have a fellowship, I had a fellowship, but also just out lecturing and teaching. We're sharing our ideas, our concepts, the things we've developed that serve patients. And when they serve patients, we're doing some good beyond our own practice and our own, development in our own cities, but around the world. So that's why I do it.
Absolutely. I couldn't agree with you more.
We're very much alike that.
We all it's like we're having the same dreams or whatever.
Yeah, exactly. So we're always nobody's asking me what my future goals are. They're always asking me, like you, we just dealt with this, what's your exit strategy? How much longer are you going to practice? And I think that you and I both agree, and you just said it. Nobody's retiring. No. Nobody's practicing. It may evolve into other things.
Yep.
And all the other ways to be involved in it, and you and I are so involved.
And it's so exciting, and we love it. We're passionate about it.
Yeah, and now you have more time, and I'm getting to have more time to really contribute more. Because when you're not stuck in your office operating all the time, it does give you the opportunity to get involved in many things, and you can really change things then. So
yeah, you're traveling internationally, you're lecturing,
all that.
You're teaching, you're writing. involved in a bunch of companies and so forth.
Yep, exactly.
I'm curious, do you have other surgeons who work in Calobrace
and always looking for new talent?
Well, there you go. You hear that? You want to work with this champion right here?
Come visit me. Yeah, so, I just interviewed 2 people this actual week to add surgeons, but I'm looking for, world-class surgeons who can come in and really deliver great things for our patients in Louisville and, go from there. So, yeah, always building on that brand and on people that I think should, I have a friend who I'm going to probably bring into the practice who's a plastic surgeon. Sometimes people just aren't great business people, but they're really great surgeons.
Right.
And then sometimes how you can help them is say, don't do the business anymore. You're not good at it, but you're a great surgeon. Let's make you busy and not worry about it. And so that's
I see it all the time with my fellows at my fellowship. There are a lot of great surgeons, but they're not business-minded or they're not inclined to do the management side and so forth. That's why certain roll-ups like the one I'm involved in right now, Phoenix, I think resonates with a lot of people who want to spend time in the OR. They don't want to worry about the management. They love doing aesthetic surgery, aesthetic medicine, and they want someone to take the burden of the other stuff off their shoulders. They weren't trained to do it.
Yes.
I mean, you have a natural knack for it. It comes to you naturally, and you love to do it, and you're very good at it. Most of us do not have that skill set.
Yeah, and I'm tired, though. so you get tired, and there is something to be said. There's something to be said for, building it and then being able to pass on something that's really healthy, still be part of the management of it, but not have all the burden and responsibility of it, because you do have that burden, and it weighs on you. I have a fellow surgeon in Louisville who I'm covering for while he's gone to India teaching, Jerry O'Daniel.
Yeah.
Jerry said, just yesterday I was talking to him and he said, we have a lot of mouths to feed. He said, so when I go to ski events, I don't ski because I just can't be injured. It's that sort of responsibility. I'm not skiing at this trip either because there's that sense that we have a lot of people that depend upon us. And I have surgery scheduled this week and they depend upon me to be there. So you do have a little bit of a burden that you have to sort of navigate, let's say, to make sure you take care of yourself, but you're also there for your patients and your staff.
Yep, I agree. Well, listen, I want to send you up to your room. You can get dressed for the panel or for what you're doing, and then I'm hosting co-chairing the panel afterwards. So I look forward to seeing you. And then I want to see you on the mechanical bull with your cowboy hat on.
Oh, I knew you were going to say that. I saw a picture of you out there with that. Great to see you, Grant. Thank you for having me on.
Thank you. Thank you so much.
Thank you for all you do for plastic surgery.
Thank you, bro.
Thanks.
Hello, everyone. Dr. Grant Stevens here in beautiful Park City, Utah, home of ABAM, the American Brazilian Aesthetic Medicine meeting. And I'm here with Dr. De La Peña from Mexico City.
You pronounce it perfectly. Mexico.
Mexico. Sí, como no.
Sí, como no. Los tacos.
Dígame. No, for my guests, let's speak only English.
Okay.
Well, thank you so much for joining us and for being at ABAM again. And you've got your ski clothes on.
Yes, of course. And I was just telling you that probably one of the great things about doing these meetings is that we have the opportunity to have science and sports, basically ski, that we do not have it in Mexico.
That's wonderful. You can do both.
Yes, we can do both, certainly.
This meeting is family-friendly also, with children coming and wives and husbands and so forth. Did your wife come or?
Yes, of course. My wife always comes to the meetings because she's the one that helped me do all the presentations. I basically go to the meetings when I have to present something.
I see.
And so she helped me a lot in all the presentations.
Excellent. Are you enjoying the meeting?
Oh, yes, certainly. I think this is a great setting, and I know that Renato, that is making all these things with Flavia, they do a great job organizing this. In Mexico, I had the opportunity to organize a lot of meetings, and you work a lot when you try to get the people that feel comfortable in the meeting, and so that the social things that you do that are helpful for the meeting as well.
Renato and Flavia do an exceptional job. Tonight is the Western night.
The cowboy party.
Cowboy party, yeah. Always the favorite, with the mechanical bull and all the cowboy clothes.
And I'm sure everybody's looking forward to it.
Yes.
To see the customs with cowboys and everything.
Absolutely. So what's going on in Mexico in terms of aesthetic surgery, aesthetic medicine? What's the latest?
You know that one of the great things about working in Latin America is that we had the opportunity to start working with a new technology. because I know that the restrictions here in the States and Canada are bigger than it is in Latin America. So we start using all the new technologies. Like, for example, I just presented yesterday, what can we do with a laser in order to raise the flap for a facelift? Mm-hmm. So I was telling everybody yesterday that we start lifting faces since more than 50 years ago, right?
Right.
But we haven't done anything in order to produce more collagen and elastin. Okay. And we age because we lack production of collagen. So now that we're doing the procedure with the laser, so we stimulate the production of collagen. Uh-huh. And so the results are just amazing because you can still doing the same facelift that you do, working with the muscles and everything, but at the same time, you're stimulating the production of collagen. So the quality of the skin when you finish the procedure and for the next 18 months is going to be amazing.
That's fantastic.
It is fantastic.
You have that rare opportunity in Latin America and particularly in Mexico to do that. You're ahead of the curve. Oh, and that's why a number of the studies are done there. And a lot of those companies send them to Mexico for studies, I know. I've worked with a number of them. That's fantastic. You're very lucky.
We are very lucky. You know, I have tried to do this. I put in Mexico, I introduce in Mexico a lot of the brands that we use today. And, for example, working with botulinum toxin, for example. Probably Mexico is one of the countries that the same amount is sold with plastic surgeons than dermatologists. Okay. Because when we introduced the botulinum toxins in the market, I tried to split it so that I tried to certify every single plastic surgeon all over Mexico in order that they can use it the same way that the dermatologist does.
Fantastic. Well, good for you.
Yes, I think it's very interesting, because technology is advancing very, very intense, and we have to keep on technology because we can have better results and less invasive.
Yes, and more safety. Well, thank you very much, Dr. De La Peña, and enjoy the meeting and enjoy the skiing this afternoon. I look forward to seeing you in your cowboy outfit tonight.
Of course. Yeah, you will see me.
Absolutely.
Thank you very much.
You're welcome. Hello, everyone. I'm Dr. Grant Stevens, and I'm here in beautiful Park City, Utah, home of ABAM, American Brazilian Aesthetic Medicine Meeting. We've been here all day at the Technology of Beauty, filming the movers and shakers in industry and aesthetic medicine and aesthetic surgery. And with me today, right here, is Max Baybak, the co-founder of Influx Marketing, my producer, my director, the co-founder of the Technology of Beauty, along with myself. And I was able to finally wrestle him down here and have an interview with him before he goes on to the Cowboy Night. We're having a special Western night tonight at ABAM. That's why he's got all his Western attire on. Welcome.
Thanks, Grant.
Thanks for being on your show.
Yeah, it's fun. I don't get to be on this side of the camera too much, but...
Well, you know, you have a face for radio.
I know.
Fantastic.
That's what we always say in the studio. Thank you.
So tell us a little bit about yourself, first of all.
Oh, okay. Well, so as you mentioned, I'm one of the co-founders of Influx Marketing. We're also exhibiting here at ABAM. We love supporting the ABAM. I started along with Adam, who I think you interviewed last year.
Yes, I did.
My business partner, our CEO, and with two other partners. We started coming up on almost 10 years ago. We worked in a number of medical specialties, helping the private practice at the private practice level to acquire patients. And we also worked for many other industries. But after a while, we said we saw something here in aesthetics, and we decided to really focus and buckle down. And that's what Influx does, and we consider ourselves, the digital agency for patient acquisition for aesthetic practices, and that's really our niche that we've found a lot of success in being very laser focused.
Well, you are very successful, and I started working with you initially with Marett Plastic Surgery. How many years ago when you designed my first website?
Coming up on 5 years ago, if I'm not mistaken.
It's got to be more than that.
It feels like, I was looking at it recently, maybe it's just over 5. I was looking at it recently, and it feels like a long time. But it also feels like an instant. You know how it is.
Yeah, absolutely. Yeah, and you've done such a great job, both for my colleagues, myself, and industry. You've done a lot of nice things for industry. And then along came the Technology of Beauty.
Yeah, I actually remember where we were. You had Marina Plastic Surgery had won the Best of the West Side Award for the gazillionth year in a row there in the marina, and I came down with my wife to celebrate and congratulate you, and you were there with Aaron, and we started talking about we should do a podcast. And I remember that was kind of where the seed was planted, but it grew. Obviously your network is everything in making this possible. But there was a time when I was kicking around, should we do podcasting as a service? There's a lot of challenges in scaling that. But we started this, and it just something I became addicted to. And so I decided we're going to focus on this podcast. And didn't know, as you and I talk about all the time, I didn't know where it was going to go. I still don't know where it's going to go. I learned so much. I learned so much in every room when I get to sit. And I like to sit behind the soundboard and, mess with the dials, but I like to listen. And I can't tell you the nuances of the dynamics of the industry, of the upstream, of the innovation, of the people who are behind the scenes bringing the future of aesthetics in terms of product innovation, and you're bringing that together. Dr. Saltz is always congratulating you for being forward thinking and bringing these two universes together of industry and of the surgeons of the entire aesthetics world. And I just sit back like fly on the wall, and I love to soak it all up.
Well, it's been a lot of fun. There's no question. We've talked about moving on with the same show, but going, if you will, marketing to providers more, not just industry, especially injectors and so forth, people, the med spa business. I know that's one of the things we talked about this weekend.
Yeah, well, I think there's a tremendous opportunity. We definitely have those listeners. I try to look at kind of, as best we can, we try to understand who our listenership is, who the audience is. We know industry likes to listen. They like to see what everyone else is doing, right? We see newcomers to the space learning all about aesthetics, which is awesome. We see startups, we see big major companies, and so many people from that world, industry side, big and small, listening to the show. We do have some more of the forward-thinking doctors, surgeons, providers, but I think there's a great opportunity to reach a larger audience there because, I don't know, I'm the kind of person who, if I'm into something, I want to understand, as I said, upstream, what's coming tomorrow, but get a sneak peek at it. Clearly, that's the kind of person you are.
Yes,
I know.
Absolutely.
That's kind of how...
putting companies together.
Well, you're even further up. You're at the birth of these companies, but people who want to understand what might be in their practices tomorrow, or figuratively speaking tomorrow, what the patients might be asking about if they want to get ahead of the curve on that. And it's also nice to put a face to the name, so to speak, and understand who the people are behind the scenes. You know the brand names, but who are the real movers and shakers of the beauty business?
Decision makers. Right?
Yeah, it's really nice to see. So I encourage everyone in all aspects and all facets of aesthetics to listen to the show. I sit on the marketing side of it, and I find it absolutely fascinating, which I could unpack forever. But regardless, I think there's a lot of benefit for.
I know a lot of people go to YouTube, and they go to the Technology of Beauty at YouTube. Where else can they find the podcast?
So really, what I always say to simplify it is it's everywhere where you would listen to podcasts. It's on Spotify, it's on Apple Podcasts, it's on Google Podcasts, and if you just Google Technology of Beauty Podcast, you'll find it. But if you listen to podcasts, you're probably listening on one of those few platforms, and it's there. It's on a number of others too, the smaller, lesser known ones.
And we have an Instagram site.
Yep, Instagram. It's on LinkedIn. It's on YouTube. There's even a few TikTok posts, but we'll get someone. We'll get someone helping us there soon more. But it's everywhere you listen to podcasts. That's what I tell people.
Okay, terrific. Anything else you'd like to tell us?
We love being at ABAM. Dr. Saltz is just such a gentleman, and I've seen him here. I've seen him all weekend running around, and as you mentioned when you had him on here, this is all for charity, and it's so we really feel special being a part of it, supporting the real leaders in the surgeons in the aesthetic space. I will mention Adam and I are going to be speaking on a panel. Actually, we're doing a workshop on Monday on kind of how you can grow your practice in a recessionary environment. We don't know. It's still, everyone is wondering, are we going to be heading into a recession here? We're officially not as of now, but we'll be doing that on Monday. I've been really looking forward to bringing some value to the audience here. Less about promoting ourselves, just what can we tell people what can we glean from the hundreds of practices we work with across the country to kind of package those insights up and help people here. So that's what we're really passionate about, and that's what we're doing on Monday. So
excellent. Yeah, I love it. Well, I look forward to seeing you tonight at the party. Thank you for all your help with my practice, with the Technology of Beauty, and for helping all my colleagues. You and Adam and your crew at Influx Marketing have done a wonderful job. Thank you very much.
Well, thank you, Grant.
You're welcome.
Alrighty.
Hello, everyone. I'm Dr. Grant Stevens, and I'm here in beautiful Salt Lake City, Utah, home of ABAM, the American Brazilian Aesthetic Medicine show. And I'm here with Buffy Clark, who lives in Salt Lake City, and she works with and for Alastin, my favorite skincare line. Welcome.
Thank you. It's a pleasure to be here.
Well, it's so great to have you on the Technology of Beauty, where we interview the movers and the shakers of the beauty business. And you're certainly working for the best skincare line that I've ever dealt with, Alastin. So first of all, tell us a little bit about yourself. What do you do for Alastin?
So I'm the account manager for the Salt Lake City territory. I am a mover and shaker in this industry.
Yes.
Because I've been in the industry for 25 years. So working back in the day for a cosmetic dermatologist and running a practice and then wanting to get on the sales side of things. And I've been with Alastin now for 2 years. So
fantastic. Well, that's great. Now you have some new products and some established products. When I've put them here, we've put them here. Let's first talk about what I call R&R.
That's what I call it too.
It is?
Yes.
Okay, tell us all about R&R.
R&R is such an amazing product because really before an R&R came to market, there really wasn't anything to fill that need for that space for a plastic surgeon to go to say, hey, what are the best products to pre-treat the skin and be able to use post?
For the body.
For the body, exactly.
Right.
So before it was kind of like, okay, we're using our, antibiotic cream, and those things are all great too, but what's really pre-treating the skin and getting it healthy prior to surgery, and also our patented ChromaFade technology we have that's specifically targeting bruising really changes the outcome for the patient and really proves to reduce the downtime, which is huge.
Absolutely. No question about it. And we put it on all of our liposuction patients, all of our non-surgicals, such as cool sculpting, any body contouring patients. As you mentioned, it helps accelerate resolution of fat as well as bruising and swelling. And it accelerates the recovery period, no question. Yeah. It is absolutely effective. Papers have been written, peer-reviewed and published in the Aesthetic Surgery Journal by Dr. Lori Cassis and others. It's a fantastic product.
We launched a year ago and really targeting a lot of these plastic surgeons here in the Salt Lake City area. And really now the plastic surgeons that brought it on, when we first launched January, they've had a whole year of using their product, and the feedback just really has been amazing, saying, holy cow, your scar looks amazing, right? You're healing so fast. The patient experience of the feedback that they're getting from the patients, like, oh my gosh, I'm healing faster. And that's what they want. Anybody that's spending X amount on surgery and then to say, okay, I'm healing faster, we all want that, right?
And the scar looks better.
And the scar looks better. So, it's great for the practice, but then also it's amazing for the patient too. So it's really, really a win-win.
Perfect. And you can buy it online also. You don't have to buy it necessarily in the surgeon's office.
Yeah. And to your point too, the clinical studies and the clinical data is huge. And that's always what has set Alastin apart is our white papers and our clinical studies.
Yes, based in science.
Based on science, that's right.
Thank you, Alan.
Yes.
Okay, well, the next product here next to me is the latest product. It's the most recent product.
Yes, very new.
The polish, if you will, right? And that's the formal name of it too, isn't it?
It absolutely is.
Now, here it is. You can see it's purple, it's granular, it's a scrub, if you will, or a polish. Why don't you tell everybody about it? I have it in my shower. I have it on my sink. I absolutely love it. I've waited over a year for it. It's a fantastic product. It also moisturizes. When you take it off, it leaves your skin feeling not just abraded like everyone likes with a scrub, but there's a certain moisturizing effect that it has. And I love this stuff. So tell everybody about it.
Those are those triglycerides. And I've been selling this product to all my accounts here in Utah, and it's been a really easy sell because people try it and immediately they fall in love with it. But what's so great about it is that physical exfoliation, but also we do have a little bit of glycolic in there too. So getting the chemical exfoliation as well. So, we want them to exfoliate, but then kind of to your point, their skin doesn't feel, dry afterwards. It's leaves this beautiful glow, and it's also super, super hydrating as well. So, and who doesn't want a purple scrub?
Absolutely. Purple is power.
Purple is power.
Preps my skin for this product, which is for my hyperpigmentations. I can only do so many BBLs and so many halos. I love Sciton. but this is now my daily regimen that I put on after this. Why don't you tell us a little bit about this magic spot cream?
It is a magic spot cream. So Illuminate, again, is such an amazing product too. We wanted something that was a non-hydroquinone, non-retinol formula, right? Non-irritating, something that they can be on forever. We also wanted a product that, a patient walks through the door and we can look and see if they have any type of discoloration. Mm-hmm. And it doesn't matter how that discoloration got there because we're going to fix it, right? Mm-hmm. It doesn't matter if it's PIH or melasma or UV-induced pigment, this product is going to work on it. So, doing the research and all those things, we say, okay, there's so many cells that are tied to those different types of discoloration. So we're going down, we're targeting all the cells, and they can be on it forever. So it's such an amazing product, and everybody needs it. When you put this product on too, you can pump it on your hand. And not only is it a bronze bottle, but when you put it on, I don't know if you'll be able to tell from here, but your skin does look illuminated and really just glowy and doing beautiful too, which you wouldn't expect from a pigment product, right?
No, you wouldn't.
Yeah. But that's where Alastin's great because really, we check the box on the science and all the things, but really the cosmetic elegance of our products as well too, right?
Agreed.
People have to like the way it feels and all those things. And, you think of pigment product, yes, it's a corrective product, but when you put it on, it's like, look at my hand. It's glowing. It almost looks like it has gold sparkles in it.
Yes, it does.
So it's an amazing product.
And then next to you is the HA product, the hyaluronic acid product, which was introduced, a year and a half, 2 years ago, something, maybe not quite that far.
It was last March. Well, last end of February, so almost exactly a year ago. Okay. So,
and I follow this with either the nectar and then this.
Yeah.
But go ahead, tell us about the HA.
So HA, again, different than any other HA in the product. I remember when we first launched HA, I was a little bit nervous because one thing that's super saturated in our market is hyaluronic acids, right? So I kept thinking, come on, Alastin, this got to be good because I've got to go up against a lot of HA sitting on the market, right? And so, but as soon as I was educated on this product, my mind was just blown saying, yes, this is completely different than any other HA product on the market. And why? Everything is high molecular hyaluronic acid, right? So we're applying high molecular on the surface. We have our patented octopeptide 45. Goes directly down to that fibroblast and tells your body to produce and make its own high molecular HA. So
fantastic.
Yeah, amazing.
Well, you mentioned earlier, I want to reiterate that this company is founded on and based on science.
Yep.
And histology and research. It's not a marketing company, it's a science company. And now it's owned by Galderma,
yep,
the largest derm skincare company in the world.
Yep.
So thank you very much for being on my show.
You're welcome.
And you're dressed appropriately to go to the cowboy night tonight.
I'm ready to party.
I'll join you there. We're going to have a great time, and hopefully I'll see you on the Mechanical Bull.
I'll meet you there.
Okay, cool. Thank you very much.
Thank you.
Appreciate it, Buff. Hello, everyone. I'm Dr. Grant Stevens, and I'm here in beautiful Park City, Utah, home of ABAM, the American Brazilian Aesthetic Medicine meeting. And with us is Alicia Marett from Zio.
Yes.
Thank you. And she's a local gal. She's here from Salt Lake City, right?
I am.
And you work for Zio, one of the best skincare lines in the whole aesthetic business.
I would say the best.
Well, absolutely one of the best in my opinion.
It is one of the best.
We were talking about the holy trinity about skincare, but that's all right. I love the skincare line. Tell us a little bit about yourself first, not about Zio. Tell us a little bit about yourself.
Well, I'm a big fan of yours and your podcast, so I feel very honored to be on it. Thank you so much.
Well, it's great to have you.
Thank you. So I've been in the aesthetics industry since 1997.
Wow.
I know. So even before we had licensing,
you were in preschool?
I was.
Okay.
I was just a fresh 12 at the time.
Oh my.
So yeah, my background is in marketing and in aesthetics. So I got into aesthetics before we even had licensing. Skin is my passion. I had horrific acne growing up and couldn't find anything to correct it. Saw doctors and tried everything on the infomercials. And it wasn't until I saw an esthetician who cleared my skin that was it. That was my calling. Uh-huh. So I've devoted my entire career to helping other patients with their skin.
That's so cool.
It's been fantastic. It's been so great.
It's a labor of love. And you were personally affected by acne.
Yeah.
So how long have you worked for Zio?
4 years.
Uh-huh. And before that, where did you work?
So I've always had my own private practice as a master esthetician.
Okay.
And I've worked for a few other skincare companies as well. along the lines, I've had my own private consulting business, helping other spas and salons and med spas grow. That's also a passion project of mine, is really helping my partners.
Well, we'll get to that. Have you always lived in Salt Lake?
Pretty much. I've bounced around as a grown-up, Southern California, Northern Cal, Phoenix, but Utah's home.
Okay. And you're a master esthetician. Did you ever use hydrofacial?
Yes, of course.
Okay.
Yeah.
Just curious, because the ZO line is part of the serums that are infused, among other things like Alastin and so forth. Okay. So tell us about practice management. What can you share with med spa owners or people that want to start med spas?
So someone that wants to start a med spa, I would say really focus on what you love and what you want to do in your practice. All too often, I see surgeons, injectors, estheticians, and they just want to do what they love. They don't want to do the bookkeeping. They don't want to hire and fire. They don't want to do the marketing. So find someone great, hire out, and focus on what you're passionate about. Otherwise, those things really kind of fall by the wayside. I see too often amazing practitioners who, their businesses tend to fail because they're just trying to do everything at once. They spread themselves too thin. So just do what you're good at, do what you're passionate about, and hire out the rest.
Sounds like great advice for all of us.
Yeah, for sure, myself included.
Well, yeah, for all of us, stick to what we do best.
Yeah.
And what we're passionate about. Right?
Yes.
How are you liking the show?
Oh my goodness. It's been so inspirational to be around these surgeons from all around the world. I'm so fortunate to work with Dr. Saltz and his incredible team, both in Salt Lake and Park City. And it's been so fun. I'm such a skin nerd. I listen to dermatology radio, plastic surgery radio. I follow you guys. I read your journals. So I'm really just like a big fangirl geeking out over there in my blue corner. It's really fun.
I love it. Well, tonight we have the Western night, the cowboy cowgirl night to look forward to, and you're dressed appropriately.
I'm dressed. I got the blue fringe.
Yes.
Yep.
Cowgirl. You're going to ride that mechanical bull?
Ooh, Dr. Stevens, my mechanical bull days have been gone for about 20 years.
Okay, how about a little
who
line
knows?
dancing?
Definitely
line dancing?
dancing.
Okay. Save a dance for me.
I'd love to.
Okay, cool. It's great talking to you. All the best. Thanks for supporting ABAM. And take care.
Thank you so much.
You're welcome.